So the patient is in the neurocritical care unit and is still stable. I'm going to go over some of the orders that we would typically see when the patient arrives to the neurocritical care unit. So we're going to do every single hour neuro and vital sign exams. We want to keep the procedural site free from any bleeding or hematoma, so we're going to keep that site flat and no bending at the waist for 4 hours after the sheath has been removed. We want to check the angio insertion site every 15 minutes for 4 times, and then every 30 minutes for 4 times, which is 2 hours, and then every 1 hour for 4 times. And then after that, it can be every 2 hours for a total of 24 hours after the sheath has been removed. The patient is going to be NPO until a swallow study has been performed, and then we can advance the diet as tolerated. If there's any trouble with the secretions or the nurse feels in any way, shape, or form that the patient cannot swallow pills or handle thin liquids, then a speech consult should be ordered. We're going to do Q6 AccuChecks if the patient remains NPO, and ACHS if the patient is eating, even if the patient is not diabetic. We want a baseline post-op 12-lead EKG done the minute the patient arrives, and we want to keep the systolic parameter between 110 and 140. The physician should order something like hydralazine or labetalol, PRN, and sometimes nicardipine as a drip to keep the patient between that parameter. It is a very strict, tight parameter. We want to keep normal saline at 100 mLs an hour, and the patient usually comes up with a Foley, so we want to make sure that the patient has strict eyes and O's and a urine output of greater than 1.5 mLs per kg per hour. We're going to give Lipitor 20 milligrams daily, 325 milligrams of aspirin daily, and then a once dose of Plavix immediately if the patient can swallow. If not, we need to get an NG tube. And then we're going to follow up with Plavix 75 milligrams daily. We're also going to do smoking cessation education and really talk to the patient and the family members about continuing to keep the patient from smoking and harmful habits. And an early AM CBC, BMP, and a P2Y12 to check the responsiveness to the Plavix.